Can everyone see that?
Yes.
Yes.
Perfect. Okay, go ahead.
All right, so I'm just going to talk a few minutes about what resources that we have available as an organization, and then what resources we have available locally. Go ahead, Elizabeth. So I wanted just to start with our mission, which is to eliminate Alzheimer's disease through the advancement of research to provide an enhanced care and support for all affected, and to reduce the risk of dementia through the promotion of brain health. So I started with this just to kind of give an overview really of what we do. We obviously are very invested in the research opportunities and side of dementia care, but we really want to be able to provide care and support to family members, professionals, overall caregivers, anyone really who is walking down this journey. So one of I'd say our best resources, maybe even the best kept secret that we have, is our 24/7 helpline. So the contact center is staffed with trained helpline agents and care consultants 24 hours, 7 days a week, who are responsible for providing support and information to anyone with Alzheimer's disease, caregivers, family, healthcare professional, and honestly, even just the general public if they just want some general information. If someone calls the helpline and maybe they don't get the information that they need, or they want to speak to someone locally, that call then is directed back into the West Virginia chapter, and typically I'm the person that will follow up with them. So the good thing about referring to our helpline is that it is 24/7, and they have access to the same materials in a sense that I do. They can give you topic sheets. They can give you information on a particular subject. They can give you a list of local, care residents, and you can get it right there. Sometimes it might take me a day or two to get back to you, but we do our best. So I wanted to talk a minute about Alz Connected. It is powered by the Alzheimer's Association, and it is a free online community for someone affected by the disease. So basically what happens is it's kind of a social networking community. So members, you kind of get on and you can connect with other folks going through the disease, going through the process. You can talk about, any concerns, advice, support. They, get the opportunity to talk with other folks that are going through maybe the same thing that they are. So it's kind of like an online forum, but there's some good communication because it's with folks that are going through the same thing. So something else that we have is our community resource finder. This is something that we partner actually with AARP for, and it is a database of dementia and age-related resources. We actually power it through a company called Care. That is actually the website, communityresourcefinder.org, and it's just an online tool that you can go to. You can find programs, you can find providers, you can find services in a specific location. So you'd go to Community Resource Finder, you'd put in the zip code, and then you kind of indicate what you're looking for. You might be looking for legal services. You might want a specific elder law attorney, community services such as like adult daycare, maybe transportation is something you're looking for. Really anything associated with managing the disease by outside providers. So, it too is another great resource that anyone can access. We also have a fantastic online tool. It is our Dementia and Driving Resource Toolkit. And it kind of gives you ideas and gives someone suggestions on having the conversation about driving. How you should approach it. Maybe when's the best time? Who should be in the conversation? When you should have that conversation. It gives you some tips about planning ahead. When do you need to be having this conversation? And it also kind of gives you a tip sheet about signs of unsafe driving. They have some videos on there that kind of help you talk through this difficult conversation, because most folks aren't willingly just going to say, here's my keys, I'm ready to not drive. It can be a very challenging discussion. So this really, really just gives you some tips and strategies. And it is on our website, alz.org/driving. All right. And then another fantastic tool that we have is our Alzheimer's Navigator. So this tool is specifically for folks obviously living with the disease, caregivers, and even professionals, I think, kind of navigate through the process or some processes that come along with living with the disease. So you basically you log in, and then you're going to select they call it a survey topic, but it might say like, do you need help with legal planning, driving, home safety, and say you click home safety, and then it's going to ask you questions specifically about that. Do you feel your loved one is at risk? Yes or no? And so going through that survey, then it generates actually kind of like an action plan. And I think my next slide, I put a sample. Yeah. So this one was one on driving, and I know it's hard to see there, but the action plan kind of shows, driving. I think the top is what you can do. It says have the conversation about driving safety, and then it actually gives you resources on that sheet of where you can find that information. Consider removing the car or disconnecting the engine. So it kind of gives you very practical tips on how to manage or how to get through that process. It's very underutilized, I feel, and because a lot of folks just don't need it. But even as a professional, medical professional, I think you can direct someone to this, or you could even quickly go to alz.org and go through this with them, and you can print that off and give it to the family as an action plan of what they need or what they could be doing. All right, so in addition to all of these things, we also provide free online and in-person education sessions. There are a couple ways to access these programs. One way being to attend a live event sponsored by our chapter. Right now, I'm doing some virtual, and then I'm doing some actually in person, and we also look to volunteers to provide these services for us. So, we're looking to present at civic organizations, social clubs, churches. We're working with some university departments, nursing students, speech pathology students, physical therapy students, just to give them a little better understanding, even if it is just one session. But we have a rotating schedule that we do here in the chapter, and then as we can, we get out in the field and also provide programs that are more specific to whatever group we're speaking to. We also have on-demand programs, and those programs can be found at alz.org/education. And that basically, you can go to that. Every program that we have is pre-recorded. You just create an account and then you decide what program you want to watch. The beauty of that is that it's on demand. So if you have to stop midway through, you can do that and go back to it. And you can do them obviously just whenever you want. And just as a note, all of our programs are based upon research and evidence-based practice. So I just wanted to show you what programs that we have. I won't read them to you because you can probably see those yourself, but those are the programs that we do have. And our Living with Alzheimer's for Caregivers series, we have one for early, middle, and late stage. And there's like 3 for the early stage, 3 for middle, and I think 2 parts for the late stage. So those programs are pretty in-depth. And then, they have to have that commitment that you'll come back for the second and maybe even the third program. So if there was something that I didn't mention here in my quick 10 minutes, you can always reach out to us at westvirginiainfo@alz.org. Me personally, Elizabeth or Mithra can get you my email address if you need it. But I hope this has helped a little bit, just showing maybe a few of our services that you may not be aware of. We're here to provide these resources and to provide this education to not only patients and families, but just citizens across the state, because we believe increasing awareness of this disease is going to help us get the funding for better research and for better service delivery. So, any questions?
Thank you so much, Teresa. That was wonderful. Great resources, and for those experiencing this, and that's really great to have that community. And I really appreciate your time today. Are there any questions or comments that anyone would like to add?
Quiet group.
No worries. If you think of anything later, that's fine too. All right, Angela, did you want me to advance your slides for you, or would you like to be a co-host and do so on your
own? Yeah, if you don't mind advancing them, that'd be great.
Not a problem at all.
Okay.
All right, my pleasure. Let me bring them up. Give me one moment, please. All right, when you're ready.
All right. Hi, everybody. My name is Angelo Gilzetti. I'm a psychologist here in the Department of Behavioral Medicine and Psychiatry, and also the Memory Health Clinic at RNI. I'm going to just talk real briefly about the effects of caregiving in dementia, and briefly talk about some interventions that we can offer caregivers to help reduce their distress and improve their lives, and also improve the lives of our care recipients. All right, so what's caregiver burden? This is kind of a term that's thrown out there pretty frequently, but I think a really good definition is the one here on the screen. It's the physical, psychological, social, and financial difficulties experienced by caregivers. So if you think about the relationship the caregiver has with the care recipient, right? Maybe it's a spouse, or maybe it's a parent. Often that relationship has many different roles and responsibilities across years and decades, right? And caregiving has been just a small aspect of that relationship. Maybe if someone has a short illness or recovering from a surgery, but caregiving does not define that relationship. Once the disease is diagnosed and starts to progress, what we find is the act of caregiving begins to take over all aspects of the relationship. So as we get into the latter stages of the disease, oftentimes caregivers will speak about their relationship with the care recipient, almost as if it's a different person, that they're relating that their husband, their wife, their father, their mother, that they used to know. And now all they are is a caregiver. It's kind of their primary role with this person. And when you care for somebody, it's going to take a toll physically, psychologically, socially, and financially. Oh, next slide, please. Briefly, some consequences on physical health that caregivers may experience. They're more likely to rate their health as poor, declining, harder to engage in behaviors that maintain a good health. They're going to report to us that they have less time for exercise, to prepare healthy meals. They're going to have increased cortisol levels and inflammatory markers. They're going to be at increased risk for hypertension, metabolic syndrome. And there's even some research that shows that they're just at a higher risk for all-cause mortality. So profound physical effects for caregivers. There's also some effects on caregivers' mental health too. So caregivers are more likely to experience depression, to develop depression. Up to 1/3 of caregivers are going to report depressive symptoms. They're also more likely to think about suicide, have higher rates of anxiety, and also descriptions of poor sleep. Next slide, please. We also know that caregiver depression is going to impact our care recipients, or the person with dementia. So if a caregiver is struggling with depression, the person with dementia, the care recipient, is oftentimes more likely to have faster cognitive decline, more depression within the person with dementia, and they're also at increased risk for premature nursing home placement. So we have some really good interventions for caregivers. Caregiving is very challenging, lots of physical and mental health effects. There's not enough time to talk about resiliency in caregivers or some of the positive things that can come out of caregiving, but they're there in the literature. But if you just have a few moments to work with a caregiver, I encourage you to think about some of these interventions you can offer them. The first one being case management. So if you have a case manager or care coordinator on staff, hopefully that person can provide education on resources, services in the area, helping with respite care applications, nursing home placements, etc. Oftentimes people don't have staff to help out with that. So we can talk about that in a little bit, what resources you can provide briefly in a quick session. Education is going to be a really important intervention for a caregiver, making sure that they have a good understanding of the diagnosis, what to expect, the course, and then of course resources that are available to them in the community, both locally and then nationally. As we were just talking about, caregivers are more likely to have depression and anxiety, poor sleep, and some other mental health difficulties. If you're suspecting that's the case in your caregiver, a referral to a good cognitive behaviorally trained psychotherapist could be helpful to help them deal with some of their own mental health symptoms. Similarly, referring them to someone, a prescriber, for evaluation for the appropriateness of medication can also be helpful. Respite care is also going to be a really powerful intervention for caregivers. And there's different forms of respite care. There's in-home respite care, where the person with dementia stays at home. There's adult daycare respite care, and there's also more formal respite care in a nursing home. But that's going to be a powerful intervention for caregivers because they're getting extra support. Oftentimes, caregivers are doing this by themselves or with a very limited social support system. So anytime we can give them to take a break, do something enjoyable for themselves, practice self-care, that's going to be helpful. And that oftentimes can be accompanied or facilitated by respite care, however brief. Support groups are very powerful interventions for caregivers. that I know there's some offered in the community. Referring to those can be helpful. Multi-component interventions are really just a fancy way of saying a combination of all of these different types of interventions are going to be helpful. And then there's some miscellaneous interventions that are helpful, such as communication skills training, positive activity scheduling for the person with dementia. Next slide, please. So if I have a few moments with a caregiver, I'm thinking two things to impart to them. One is resources, the other one is education. So I didn't put this up here because I knew Teresa was going to be talking about the Alzheimer's Association, but that's really my go-to resource that I encourage caregivers to look out for, to look up online. And then I also encourage them to find local resources. So your local senior center through the county is going to be a wealth of information. And then if your patient's in West Virginia, these two organizations or state resources are going to be really powerful. So the West Virginia Bureau of Senior Services is a great website that lists all the resources available to West Virginia residents and help with in-home respite care and in-home care, Medicaid waivers, etc. And then the West Virginia Aging and Disability Resource is a good online tool that the caregiver can go on, type in their zip code, and it'll list out all the resources available locally in that county for a range of different resources. So financial resources, in-home resources, support groups, medical resources, etc. It's just tons of resources. And then, of course, you can search surrounding counties as well, too. If your patient is, the patient with dementia is a veteran, I would encourage you to refer them to the VA if they're enrolled in care, because the VA has really good resources, not only for patients with dementia, but they also have a very comprehensive caregiver support program that has been expanding over the past couple of years and is very helpful. The other intervention I think of when I just have a few moments with the caregiver is just education. So just going over some really basic but fundamental skills that they can employ at home with the person with dementia. First and foremost being communication skills. So just helping them understand, how to talk a little bit differently with their spouse or their parent. They've been talking and relating to this person for if it's a child, their entire life, right? Or if it's their spouse for potentially many decades. So helping them shift the way they relate to this person is going to be very, very powerful. So having good eye contact, positive tone of voice, calm voice, limiting choices, asking really brief questions. Those are going to be good skills for the caregiver to start to practice at home as they start to learn how to talk with this person a little bit differently. Encouraging the caregiver to be a good promoter and ally of the patient engaging in positive activities. That's going to help with the patient's mood. It's going to help with structuring the day, which is another skill I teach caregivers. It's really important for the caregiver to start to set up a good structure and routine for the patient, so that the patient with dementia has kind of an intuitive sense of this is how the day is going to go. It's going to be predictable and not much change, not too much stimulation, and not understimulation. I also check in briefly with the caregiver about safety at home. So reviewing firearm safety, medication safety, kitchen safety, making sure the stove's not being left on, sharp objects, fall safety. If the patient with dementia is starting to wander or is at risk for wandering, talking about door alarms, medical ID bracelets, etc. Just so we're starting to socialize the caregiver to start thinking about how they can promote safety at home. And then lastly, you may only just have a few moments, but just acknowledging that the caregiver has a lot on their shoulders and just checking in, hey, how are you doing? Is going to be really important. Oftentimes they're unseen. They're not that quote unquote patient, but they're instrumental in our care of our patients. Without them, it's very hard to care for our patients with dementia. So just checking in, acknowledging that they have a lot on their shoulders is going to go a long ways, encouraging them to take time for themselves, self-care, linking in, encouraging them to touch base with their primary care providers, referring as needed, depending on what you're seeing. So real briefly, just some quick takeaways. Caregiving has a lot of stress, physical stresses, mental health stresses, but we have some good things to offer caregivers to help improve not only their lives, but the care recipient lives as well too. And I think if there's one thing to take away from this quick little talk is by helping caregivers, we're going to also help our patients with dementia. Thank you. Appreciate your time.
Thank you so much. You have a very calming voice, as you said, how to talk to somebody. I felt like you were talking to me and calming my energy down. Thank you. No, that was really informative and very important. You know, being a caregiver is a huge responsibility, and we have to be grateful for those. And as you said, they're instrumental in the success, you know, and health of that patient. So does anybody want to add anything to this? Dr. Keith, do you have anything to add?
Yeah, so I didn't prepare any slides. I figured I would sit back and listen to what Teresa and Angelo had to say first, and then I would fill in some other ideas just as they came to mind. So first off, thank you, Teresa and Angelo. That was really, really excellent, and I second everything that's been said so far. I think all of that is very, very important. I'm a huge advocate for the Alzheimer's Association. I feel like I mention it and excitedly talk about all the various services with nearly every patient I see, so I super appreciate that resource. A few other themes or thoughts that just kind of came to mind as you both were talking that I think it's important to be mindful of when working with caregivers. The first, related to what Angela was talking about when it comes to kind of checking in with caregivers, is the theme of guilt. I feel like with many caregivers I see, there is a lot of guilt in terms of, am I doing a good job? Am I making the right decision? Is this what my loved one would want? Is this the right thing? And so I think kind of meeting caregivers where they're at and also reassuring them that there is no one size fits all. There is potentially no exact right decision in situations like this, and that you're doing the best you can. And these situations are very, very complex. A lot of these decisions are not straightforward. They're very complicated, and that there may not be a perfect decision, and that these often are made as a family. And I'm not going to be the one that's going to tell you exactly what to do in some of these situations, how it's a lot of times a more complex discussion. So I think kind of validating that you're doing the best you can, being very validating when you're giving coping skills and when you're giving skills in terms of communication and how to interact with patients with dementia, that people are doing a good job, they're doing the best they can, and it's okay to ask for help as well, because I find that there's a lot of guilt surrounding asking for help. I married this person in sickness and in health, so it's all on me to take care of them, and so reminding people that it's okay to ask for help, and in fact, they'll be better off if they ask for help, because you can be a better caregiver when you're doing better yourself. So kind of approaching that guilt in caregivers, I feel like, because it definitely rears through, I feel like, in a lot of situations, and kind of acknowledging that and acknowledging how difficult these situations are and how complex they are, was one thing that came to mind. A second was more kind of inter-individual factors that can impact the caregiver recipient relationship. And for instance, these kind of historical relationship factors can potentially complicate your caregiver relationship. So I'll give an example here. Dr. Miller and I actually saw a patient recently who was pretty emotionally abusive at baseline towards her children and grandchildren. And this all got much, much worse once she then got dementia. And so this really complicated her son being able to step in and caretake for her. He was kind of shielding his children from her because he felt like she was just kind of ripping into them and tearing them apart emotionally, and they weren't really able to care for her in their home. He had more trouble kind of going into her home and caring for her because he was juggling all of these roles while also navigating keeping himself and his family safe from kind of that abuse that was there before but now has gotten worse. So there are kind of these premorbid historical relationship factors that can then impact the caregiving role. I saw another patient recently who talked to me about how when her mother came to live with her, that was really a trigger for a lot of her PTSD symptoms. Because growing up, her mother actually turned the other way while she was unfortunately sexually abused. And so then years later, when her mom came to live with her, that kind of raised to the surface a lot of those issues that she hadn't quite worked through yet in terms of her feeling very betrayed by her mother. And that kind of impacted her caretaker role as well. So there are also all of these kind of complicated factors that vary from person to person that are there and can impact the caregiver recipient relationship as well, which we see a lot of. And then a third thing, finally, another thing that I like to think about is this sense of kind of ambiguous loss that these caregivers often are experiencing. So their loved one is here, but they're not here. They feel married, but they also feel not married. And this can be confusing and complicated to work through. In addition to some of these kind of role transitions. So your spouse no longer feels like your spouse. It's more like taking care of a child and feeling like your loved one is both present and absent. And so that's kind of another complicated factor. And these are all just things that I like to be mindful of when I'm working with caregivers because they can complicate the role and I think are important to think about. So those are my kind of random ramblings of things that popped into my mind as I was listening to both Teresa and Angelo, but thank you again for that. I think that was very informative and helpful.
Thank you so much, Dr. Keith. Those are all excellent points. And I think being aware of that, I think in family, it's a little more complicated too. Sometimes you take advantage of somebody that is doing such a good job and it's hard to get more hands in there occasionally. And it can be a very challenging time. So appreciate those comments. Does anybody else have any comments that they would like to add or questions? Dr. Miller, you're on mute. I think you're trying to speak to us. There you go.
There, how's that?
Perfect.
Okay, just add a couple of things to take off on what Angela was saying about safety. I had a patient once who was an electrician, and one day he had dementia, vascular dementia. His wife was reading a magazine and the lights went out in the house. And she's like, uh-oh, what was that? Went to the basement and he was cutting the wires in the electrical box with a pair of wire cutters. And she said, what are you doing? They were sparking. He says, we always did this. And she's like, I don't think so. And so, you know, even though he was an electrician, he's now a demented electrician, not using common sense or safety principles. And so this patient also lived within walking distance of a hardware store. And he had this habit of picking things up and putting them in his pocket when he'd find, and his wife would do his laundry and he had pieces of string and screws and nuts and what. Anyway, he'd go in the hardware store and he'd be looking over things and unconsciously put them in his pocket. Well, they caught him on camera and we're going to charge him with theft. And finally, the manager gave him a warning, but his wife was mortified. Oh my God, this is a shame in the community. He's bringing shame on the family and whatnot. And so she had arthritis. She couldn't like chase after him when he would go on walks outside. So a few months went by and she did his laundry and found something else from the hardware store in his pocket. and she was mortified. Oh my God, he's gonna get arrested. So finally, I had this wave of an idea, and I said, you know what? If he has this habit of putting them in his pocket all the time, why don't you sew his pockets shut? And she said, oh, that's a great idea. And that's what she did, and that solved the problem. So sometimes, simple little fly by the seat of your pants solutions can help. But our patients who live on farms and drive tractors and use chainsaws, I recommend that somebody go with them and observe, just like you drive with them and see, are they using their turn signals? Are they using safety? Should they be using these things or not? Because they're dangerous. 2 years ago, I had a patient who tried to mow on too steep of a hill and rolled the tractor over, and he could have killed him. So there comes a point where we say no more driving, but we don't always think about farm machinery and dangerous tools. We have to think about that too.
Thank you very much. So what is your advice on handling correcting someone that is doing something wrong? Because sometimes, they get defensive, and it's hard because you want to be stern, but also understanding.
Yeah, well,
they might argue back with you, and it's very
course.
challenging.
They're going to argue back, just like they say, I've been driving before you were born, you whippersnapper. Don't tell me I can't drive. If there's someone else on the farm who does chainsaw, like a son, I say, why don't you work with your son cutting the wood? So, he can keep an eye, and he's really there to supervise. Push comes to shove, you have to take the toys away, take the keys to the tractor, move the chainsaw somewhere else, and just say, some people do it differently, even with cars. Families won't want to confront the patient, so they disable the car, or they move it somewhere where they can't find it. They say, oh, that's in the shop every time he asks, and they stop asking after a while. Same thing with the chainsaws. They might just disappear them as opposed to forbidding him from using them. But, just like with driving, I had a patient who was using the yellow middle line as something you straddle with your two wheels, like a toy train or something, to stay on the road. And this was on a road where there were like fracking trucks and all kinds of heavy machinery. And finally, what just said, that's it, no more driving for her, take the keys, do what you have to do. But it's whatever her reaction is, it's better than getting a call from the state police. That was a horrible accident. And we as physicians, and somebody could hold us liable. Why didn't you take away their license? So we have to think about those things too. I came in late. I apologize. I don't know if you mentioned medical power of attorney, but if you have that ahead of time, when they're a sound-minded body, say, Mom, if you get too sick to speak for yourself, who do you want to make medical decisions for you? Say, well, I'd like you to do it. Okay, well then let's fill out this paperwork. Once you do that, technically, you have the right at some point to declare her incompetent and say, I'm going to make the decision for her. No more driving. Yes, you need to go to a nursing home. Yes, we're going to do this procedure or not. What I have often done when it comes to wills that are sometimes contested, if a new will is made, I think I mentioned this last time, is I documented the chart whenever they make go to the lawyer to make a will or do a medical power of attorney. I document that I thought they were a sound-minded body to be able to designate who they wanted and that they were competent, when they at the time. So it locks it in to the medical chart. So if they subpoena them later, trying to contest the well, you're on record saying she looked of sound mind and body to me. So these are little things that we can do to try to ease their burden. Sometimes I've had family meetings, if the family's not all pitching in and sharing, and the one who's doing all the work's complaining, and say, well, she's everybody's mom. It's time to have a come to Jesus meeting about this, because she's not going to get any better. And I agree with you. It's not fair for you to do everything when they're capable. So, working out a schedule. How about on Saturdays you take mom and do something with her, so that I don't have her 7 days out of the week. Caregivers need a break. I usually say, a half a day to yourself is not a whole lot to ask per week. You go get your hair done, just go shopping, just go somewhere, take a nap, long nap if you want. But you got to have that or you'll burn out. And that's just human nature. You didn't give up your life just because someone else got demented. You have to remind them of that.
Thank you very much.
Sure.
Appreciate that. Does anybody else have any questions or further comments? All right, well, you'll get almost 15 minutes back to your day. We really appreciate everyone that's joined in these cohorts these last couple of weeks. This is the last one. Just keep looking for updates on what is going to happen next with memory health. Okay. Really appreciate everyone. Thank you very much and have a great, wonderful day.
Thanks, everyone.